Good evening, everyone. Dr. Charlie Ware here. Sorry I'm a bit late. I actually had two emergency patients I had to deal with really quick, but I apologize for being late. I did say I would be here on here live at 6:15, but I am here to discuss constipation and chronic disease patients today. Again, I'm here just to give some great advice on how to alleviate constipation and or how I can improve different health conditions as well. Constipation is a very big issue dealing with chronic pain patients. It's one of the things that I tell patients a lot, that if you're taking pain medication, you have to make sure you're hydrated properly or do different measures to actually alleviate it. So let's jump into it. Constipation. What is constipation? Constipation is basically the issue when you don't go to the bathroom. Some people, it's a little bit of debate when people say, well, if you go every other day, you're fine, or every 3 days, you're fine. I have some patients that go once a week or once every couple of weeks. So that is kind of extraordinary for me to even think about that. But in general, true health and true well-being, you should go to the bathroom at the very least once a day. With most of my patients, I say if you go twice a day, that's great. If you go 3 times a day, that's also phenomenal. Never be afraid to actually, excuse me for a second, I gotta catch you. My tripod is acting up right now. But how you doing, Tamika? Nice seeing you on. But constipation, the reason why constipation is so dangerous realistically is because you gotta realize that the intestines is designed to actually get rid of bacteria. I'm just gonna get rid of waste. And also absorb it as well. So if you're not going to the bathroom almost every time you eat, or at least, like I said before, at least once a day, there's an issue. There's a chronic issue that we have to deal with. A lot of times, there's various reasons why people actually have constipation, and usually it can be due to the fact that they're not drinking enough water. Pardon me for a second here. I apologize. Got to tighten up a little bit so it won't fall down again on me. It can be due to not drinking enough water, or it can be due to the fact that majorly you're not having the correct oils in your system. Now, I'm not saying eating a lot of fried foods and things of that sort. What I'm saying oils wise, you're not eating enough fresh food, like fresh fruit, fresh vegetables, or sometimes you can be overeating certain incorrect things like the fried foods and things like that. So I'm gonna break all that stuff down in a few seconds too. I want you guys to really understand what I'm saying. When it comes to a chronic disease person, someone who's on chronic pain medication, we all know the side effects to a lot of these medications is it takes a lot of your trace minerals out of your system and either help you not uptake it properly, or it actually helps you dump it out your system a lot faster. A lot of the chronic pain patients, you tend to have a lot of cramping in your legs or cramping in your lower back or spasmings in different areas. So that's really an indication that your body's lacking different trace minerals that's going to allow you to basically have proper gut motility. And gut motility is very important because of the fact that that's what actually helps the food digest itself and actually move it around your system as well. Another thing is a lot of them actually uptakes different ions. Ions are like, H2O. The hydrogen, the H on there is a positive ion that's allowing your body to sort of get rid of certain things or have certain other chemicals attached to it as it moves through its body. So some of these things are dehydrating you as well, meaning different pain medications are shown to actually dehydrate you or have a side effect of causing constipation or sometimes diarrhea. So long story short, what I want to say is if you're taking these medications, the reason why they have you in the Miralax or other suppositories to allow you to go to the bathroom, they already know the dangers from that. But then what is the danger of being constipated? The danger of being constipated realistically, like I was alluding to before, is the fact that you're not absorbing your good nutrients effectively enough, and then you're allowing other nutrients sort of sit in your belly a little too long and then sort of ferment. And again, if your body's designed to get rid of the waste and you hold on to the waste, what do you think is really going to happen? You just keep reabsorbing the bad stuff over and over again, causing more toxicity inside of the gut itself. Now, I told you last week the reason why we actually added beta-glucan to our green juice is because of the fact that essentially that beta-glucan is going to allow your body to clean the microvilli, those little fingers inside of your gut that actually are supposed to stand up and sort of suck away and absorb all of your nutrients out of your body. If you have a lot of stool inside your intestines, a lot of times what will happen, all that stuff will sort of lay down and not allow your body to absorb it efficiently and effectively enough. And again, what tends to happen is the constipation can also cause other pains too, because again, as you're sitting there and not really moving or moving out your system. I've recently had about 4 or 5 patients come to the office just last week alone with severe back pain. And my first question, or first thing I do is I palpate and make sure that their stomach is nice and soft, things of that sort. If their stomach's hard and rigid, either they're holding themselves in or they haven't gone to the bathroom. My next question will always be, have you gone to the bathroom today? Or the last minute they've gone to the bathroom. Most of them were actually chronically constipated, and 3 of them were sickle cell patients, and the other 2 were actually diabetic patients as well. And what I always say is, if you're not going to the bathroom, imagine trying to twist a hose up into a small little box, because your intestines is anywhere from 27 feet to 37 feet long inside of your gut. Now imagine stuffing that full intestine or full water. The hose is actually full of water. Imagine stuffing that inside of a box, right? Because everyone wants to roll up their water hose after they finish using it when it's flat and not full of water. If you try to do that when it's full of water, it's not going to happen. It's going to fly all over. It's hard to stuff it down inside there. Imagine that being your gut, because that's what essentially happens. You got to look at your gut as being a water hose that's actually, again, pushing things through and having this constant flow of you absorbing or getting rid of it constantly. If you tend to be constipated, what happens is all that fecal matter, which is what it is going to keep pressing over and over and over again until it's just piled up and it's pressing inside of a cavity that it should be about that flat. It just gets wider and wider and wider and wider. And the reason why it gets wider is because of the fact that it's starting to press on your back. It's starting to press on your nerve, your sciatic nerve, things of that sort. I've had people come into my office who are majorly in pain from sciatic pain, and their entire pelvic floor is completely inflamed because of the fact that they haven't gone to the bathroom in about a week and a half. So things like this sort of happen constantly. People are thinking that they're in major pain crisis or they have these huge issues with them, but they're only constipated. So the first thing you want to check to make sure that you stay nice and healthy inside of your gut and have good gut motility. The main thing you can do, first and foremost, stay hydrated. And then when I say hydrated, please, I don't say carry around a gallon of water and drink that gallon of water within a day. If you're not eliminating that amount of water a day, you don't have to replace yourself with that amount of water. I usually tell people, once again, between 36 and maybe 50 ounces of water is a good place to start. And good water that has trace minerals inside of it. Like I said, over and over again, a lot of the water we have today, we filter it out so much because of the fear of contamination and things of that sort. We have nothing good, no good trace minerals left inside the water. There's several different ways you can actually have good water. You can of course, filter it out, but get a good trace mineral complex to put back in there. Or you can add a little bit of lemon, a little bit of either Himalayan or Celtic sea salt to it. Sounds like, I'm putting salt in my water, but you don't even taste it, especially if you're using it about 32 ounces, and you put a half a teaspoon of the Celtic sea salt or Himalayan sea salt inside of there and shake it up. You won't even taste the actual salt itself. And the reason why, because your body's going to absorb a lot of those nutrients. Celtic sea salt and Himalayan sea salt has anywhere between 96 or 120 different trace minerals naturally inside of it, whereas regular sea salt only has about anywhere from 6 to about 10 different trace minerals. So you see the difference of things being filtered out of our water as well as out of our different foods as well. These trace minerals are the magnesium, the selenium, the zinc, the potassium, the niacin, all these things that are naturally in nature that we should be having in our body, but we forget that we don't have it on a daily basis. A lot of people say to me that, well, I have a cup of coffee every day because it helps me go to the bathroom. Well, it's great because that's a vasodilator. The caffeine is a vasodilator, so that they'll drink it and all of a sudden, they feel perky and all of a sudden they feel nice and relaxed because their intestines are relaxed, and then boom, they go to the bathroom. I'm not saying have a cup of coffee. I'm just giving you an example because what starts to happen is this right here. The caffeine can actually dehydrate you even more. So they may have that one cup of coffee, that one bowel movement. Now for the rest of the day, they have not hydrated themselves properly. So they need that caffeine every day to sort of make themselves go. So if they don't have the caffeine, they start to get constipated as well. So again, you want to maintain a good nutrient level inside of your system. The second way to do it, I tell people, I love hemp oil. I love Himalayan sea salt oil. I love hemp oil. I love coconut oil. I love different oils that are going to add value to your life. The reason why I love hemp oil is one of the few oils that actually have all the omegas inside of it, 3, 6, 9, and also 12. That's going to actually make sure that your body is getting all the nutrients from an oil level, from a fatty acid level that you should really have. And actually, the other thing that I love about hemp oil, it actually has epithelial cell repairing. So it has some GFRs inside there. That basically means that when your body grows different cells, the epithelial cells are being affected by the hemp oil, and it helps it grow a lot faster. So any sort of like organelle damage or arterial wall damage, it'll help repair that a little bit faster as well. The coconut oil, we've seen the benefits and heard the benefits of coconut oil on a daily basis. Again, yes, people are fearing of having high cholesterol, but that's also a fallacy or a ratio issue people don't really look at. The reason why I say have the good coconut oil is also been shown to help with the inflammation, but it also will help you go to the bathroom because of the fact that it's actually relaxing the intestine, getting your inflammation out, but also help pushing a lot of that fecal matter through because it's also lubricating and making the walls nice and loose and less rigid as well. Okay. And then or you can also do flaxseed oil too. You gotta be careful with flaxseed oil because flaxseed oil can actually go rancid pretty quick. That's why if you get it in a bottle and you don't press it yourself, you see it in a bottle in the refrigerator. So make sure it stays in the refrigerator. Like I said, it can go rancid pretty quickly. So if you get it and you use it, you want to use it pretty quickly as well. How do I usually use this? I use it several different ways. I mean, it depends on what oil I'm using. I may just have some warm water, about anywhere from 2 to 4 ounces of warm water. Use, like, again, a little bit of lemon juice, fresh squeezed lemon juice, about a half a teaspoon. And I'll put maybe a tablespoon of the coconut oil or the hemp oil or the flaxseed. Flaxseed, use maybe a teaspoon of it inside of the oil. Stir it real quick and I drink it down. The reason why I do that is, 1, it's alkaline in my body. 2, is anti-inflammatory, but 3, I'm getting a huge dose of those omega oils in my system to help the any sort of inflammatory thing. That's going to help, 1, with my intestines, and also going to help with my joints too, because I'm getting inflammation out of my joints. And 3 is giving me those omegas that's actually allowing my cells itself, the cells, either red blood cells or natural hair cells or whatever, to get nice and plump and get all the nutrients it's supposed to have as well. So those are 2 easy ways that you can actually allow the intestines to relax. The third way people tend to be constipated and they don't realize they're constipated because of this right here, stress. You know, I want everyone who's watching right now, quite a few people are watching right now, and I appreciate each one of you being online, but I want each and one of you guys to actually take a really deep breath. And notice one of the first things that actually start to relax, your gut. Why does your gut relax? Because you're holding your gut naturally tight. I used to tell most of my patients before we start any treatments, take 3 deep breaths, nice and slow deep breaths, because I want them to get nice and relaxed before we start anything anyway. Even my friends and family, you know, if there's an issue in the household, if my kids will say, take 3 deep breaths. I'm trying to get you to breathe and relax because it brings more oxygen to the brain and calms the brain to relax, but also relaxes the gut. Most moms out there that, you know, they come in here and they're like, I'm so stressed out, I'm so stressed out. And one of the main things I always complain about is constipation. Most guys I know, they're like, man, you know, I go to the bathroom every 3 days. I'm like, what are you talking about? I said, either you're eating too much meat or you're stressed out, dude. You need to, you know, de-stress yourself. So a lot of times when I start de-stressing people, they say, man, I'm going to the bathroom so much now. I mean, how often you go? I'm going twice a day. I'm like, wow, that's amazing, you know? And it's really, really good for you to de-stress your body and actually have your organs stressed free as well, especially your intestines, especially your diaphragm. Your diaphragm, which is like, you know, is like a big drum that actually pulls down the lungs themselves, but it also massages your gut as well to actually make sure you're pushing everything going down. So one easy way for you to de-stress yourself is to take 3 deep breaths. You know, I say every hour. You know, if we're going to compete or at your job, just take a step away and actually just de-stress yourself as much as possible. You know, how you doing, Ms. Carter? But you definitely want to make sure that, you know, you're looking at, you know, how your body is feeling when you're in a stressful situation. The first thing you do, most people, they clench their teeth together, their jaws, and they also clench their gut together. You have to learn to relax. And most of us don't ever get out that fight or flight situation. So you walk around with tight guts and tight jaws, and you grind your teeth at night, and you're not going to the bathroom, you're getting these constant headaches and all these other things. And that's one of the side effects. A lot of my people who are stressed out, they have constant headaches. They have the migraines. They have all these things, and it's directly located right here in the gut. It's not some outsourced type thing or you have some sort of neurological issue. What happens is you're holding your gut so tight, you're not getting the proper nutrients, so your body's not able to actually feed your body essentially. Because the fact that you're now chronically constipated. Either can be a nutrient deficient, as I said before, it can be dehydration, or it can be stress as well. Yes, there's some structural things you can do that that will make you constipated. Like I said before, a lot of pain medication will also do that as well. I'm actually quite constipated now. I don't barely breathe. What can I do now? I've been drinking lots of water. Miss Holmes, what you can do right now to make sure that you are de-stressed is, like I said, the 3 breaths would be great. Or you can start taking some sort of oil in your system as well. Or eat lots of pineapple and papaya. Those have enzymes in it to help you digest your food and also make you go to the bathroom as well. And thank you, Miss Ingrid. Thank you for the love and blessing. I truly, truly love that as well. Miss Carter, you say you have tight shoulders. Those tight shoulders are directly related to the stress. Again, when you feel the stress, and you're going to be talking about constipation, but related to the stress as well. What you do? First time you feel stressed, you do this. And you walk around with your shoulders up by your ears. Everyone has their shoulders in their ears. You got to learn how to relax. Take those 3 deep breaths as well as refocus your mind. One reason why I really started to do a lot of the auxiliary things that I do as far as like sickle cell with the less stress and the peaceful calm were for the caregivers and also for the individuals themselves. The anxiety levels, the stress levels for the pain and not knowing to be in pain and having to treat the individual and the next crisis and all that kind of stuff, that stress just start to, build up. What I've designed these pills to do really is to really de-stress your body and not have your body react to it as much. I myself used to take these same things for years and years and years. I stutter a whole lot. Sometimes you hear me stutter, but when I don't have this stuff in my system, you hear me stutter because I'm overthinking. I'm trying to think too fast. I calm myself down naturally by taking these things. I love less stress and also peaceful calm as well. And thank you, Ms. Minister, as well. Thank you so much. And also, Ms. Ingrid, thank you so much for even asking the question. I really appreciate it. This is the reason why I do these forums. I do these lives constantly. People try to get me to pre-record a lot of things, but I like having you guys interact with me. It's allowing me to give you guys what you are looking for and what you're searching, because we don't really talk about constipation a lot, do we? No, we don't, because everyone's embarrassed they haven't gone to the bathroom, or if they go to the bathroom, everyone's embarrassed, but you have to go to the bathroom. The only way you get your body well is by going to the bathroom. It's home, luckily, exactly, yes, please. A little bit, well, if your pineapple juice is not from concentrate, I'm being a little hard and on you now, but, just put the coconut oil inside the pineapple juice and drink it down. Trust me. Those enzymes will help you start breaking down that food and everything else, and you'll feel better. And also, just again, learn how to breathe every hour. Breathe, and breathe and relax. But like I was saying before, I was getting back to giving you guys valuable information that you can use on a daily basis. I'm not trying to give you things that I think you may need. These are questions I get in our private forum, or I get on different calls with other groups or whatever. And these are questions people always have issues with, because once again, over and over again, if you go to any pain management doctor, they're going to ask you, oh, are you constipated? Are you constipated? Because they're trying to make sure that this pain medication is actually working efficiently and effectively for you guys. Okay? And if they start making you constipated, they're like, okay, well, let's start giving you this Miralax. Like I said, if I see a 14-year-old child in my office one more time and they're on Miralax because they've been on the highest dose of different pain medication for so long and they can't go to the bathroom, but they keep having the same back pain, I'm like, Mom, Dad, make them go to the bathroom. And that's the only thing I do. A lot of times I don't even focus on the pain. I say I'm trying to focus on making them go to the bathroom. And 90% of the time when they go to the bathroom, pain's gone. I already told you about the people I had last time. Without going to the bathroom. Yes, it is not normal for someone to go for an entire week and not go to the bathroom. That's just bad. Okay, and I say bad because of the fact that I'll give you another example. Would you essentially try to travel from here to Ghana and not urinate one time? I mean, the flight from here to Ghana is about a 2-day flight from here to Germany, or here to London. You fly down to Ghana. If you don't urinate once on that entire trip, how would you feel when you finally got to your final destination? I mean, the worst sensation you would ever want to feel. And it's the same thing, but the opposite when you go, if you don't defecate, you're just reabsorbing those impurities over and over and over again. And like I said, a lot of the headaches or migraines are actually linked to people not going to the bathroom on a constant basis. Allergic to pineapple, but I will start the coconut oil. If you're allergic to pineapple, have you tried papaya? Or have you tried kiwi? Or have you tried avocado? Avocado, again, has a lot of different natural oils inside of them. Even some individuals, if you eat apples, just eating apples is different enzymes inside apples that'll help you, digest your food as well. Just play with it. I mean, I would say banana, but sometimes banana really doesn't do the trick. It can work the opposite sometimes. But just try to eat it. Of course, eat your leafy greens. Eat your raw fish. That's going to help you go to the bathroom. And then if you have any other issues, always talk to me, and we can sort of sort this thing out and work together to help you out. Again, thank you guys for all the comments. This is phenomenal. I really appreciate this. And if you guys feel as if I'm adding value to your lives or adding value to your loved one's life, please share this information with them. Please share in other groups, things of that sort. This is what I'm here for. I'm here to give you information that's going to add value to your life. I appreciate it. If you guys have any more questions, feel free to continue to ask me the questions. I'll be online for another half an hour or so. And feel free, I'm here to answer your questions, and I really appreciate it. Have a blessed night. And again, what's the 3 things? Learn to breathe and de-stress yourself, hydrate properly, and the proper nutrition. Okay, those are the 3 things you need to focus in on. I know it's about chronic pain patients, but even if you're taking pain medication, 90% of the time is going to be because of the fact that pain medication is taking things out of your system that you got to replace. A good trace mineral complex, the good oils, and again, stop being so stressed. Love you guys.